Open your mouth. I know you're here for a dental checkup and I don't have time for introductions. So, open. Okay. And have you been experiencing any issues recently? Or is there anything else that you think I should be made aware of? Okay. Alright, well, like I said, please, open your mouth. Sit. And then let me just a quick inspection like this. Okay, sit. Keep your mouth open for me. Okay. Just having a little gentle feel around the inside of your mouth and gums, just there. Okay, good. Alright, I need to get a bit of a closer look. Right. Okay. And just open wide for me again. Okay, good. And just keep still for me while I check your teeth. It's good to check your teeth. Okay, just like this. Just work my way around. Right then, let's get a bit closer here. Let's have a look here. So, tell me if you have any sensitivities while I check your teeth. Check your teeth. Check your teeth. Check your teeth. Okay. Starting here. 11 and 21. Mild enamel erosion. And coming over to this side. 12 and 22. Okay. Slight rotation. Likely orthodontal relapse. Relapse. And coming up to this side here. Okay. 24. Premolar. No concerns. Do you use an electric or a manual toothbrush? Okay. Open your mouth again. Okay. Right. Okay. Looking now at 33. Okay. Gingival recession of approximately 2 millimeters. Okay. So just coming around this side. Okay. Keep your mouth still for me while I check your teeth. Check your teeth, check your teeth, check your teeth. Inspect your teeth. And now we get to the lower left molar. Significant calculus, distal surface, marked mobility, severe periodontal involvement, extraction indicated. Okay. I just need to switch tools here, okay? open again for me? Okay. That's it. I'm just going to have a little explore of your mouth here with this. Okay. So, right. Okay. If I just start on the lower arch and okay. That's it. And down this side. Still on the lower arch. Okay. And what about the lower left side? Right, okay. And coming upwards to the upper arch. Okay. And on the other side. Okay, that should only feel like light pressure along your gum line, but was there any areas of sensitivities? Okay, well, your gums are bleeding slightly, particularly along the lower left arch. Just here. And for the purposes of the notes, that is mild bleeding when pressure is applied across the gums, in particular in the lower left arch, which is the same location as the problematic 36 that we have identified. Okay, so, right, you can close your mouth for now, please. So, what I need you to do is make your oral hygiene a priority going forward, please. Don't buy into any gimmicks such as charcoal, toothpaste or the likes. Just stick to a simple but regimented dental cleaning routine. What is your sugar intake like? Okay. Well, I recommend that you get this 36 lower left molar extracted due to cavity, and we'll be going ahead with that today. Due to the mobility, root morphology and deep periodontal damage, the fee for the extraction will be £380. I do not accept credit. And to make sure that this doesn't happen again, let me take a moment to show you what healthy teeth should look like. Okay, so as you can see here, my teeth are not perfectly aligned like yours, but that should not stop you from accessing all of the areas in order to give them a thorough cleaning. Okay, so if you start a location to begin your cleaning at, and then methodically work your way around each section of your mouth, you shouldn't miss anything. Okay, so if I, for example, started here at the front like this, and I could slowly work my way back, and you have to keep going back as far back as you can possibly reach with your toothbrush blade, like this. Okay, and once you've done the front side, go along the underneath. Okay. Okay, and one section, but overall you need to make sure that you are cleaning for a minimum of 2 minutes. If it's taking you less time than that, you're not doing it properly, okay? Right back. And along the bottom. And then back of the back. Okay, that would be the top section, and you can do the same again all the way along the bottom, okay? Okay, have you got that? Right, okay. Good. And if you feel like you've missed any sections, just go back round. Do them again. Okay. But you should end up feeling squeaky clean, squeaky clean, squeaky clean, squeaky clean. Okay. Okay. And the final things that you need to remember to do is to floss down the caps of each of your teeth all the way across the top and across the bottom here. Okay. Okay. And the other step that you mustn't forget is to clean your tongue. Okay. Don't forget to clean your tongue. No excuses whatsoever for not doing that. Okay. Clean, 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 clean. And once you've done all of that, you should be clean, 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 clean. I really hope that I've not taught you anything new there, because this is all information that you should have known a long time ago. Okay. Right then. We can now prepare for the extraction. Okay then, so if you could just open your mouth again for the suction tube. That's it. Open your mouth. Okay. And then just hold still for me while I thoroughly inspect the extraction site. Okay. Right then. Okay, so open your mouth for me. Okay. Taking a closer look, right here we have lower left. Extraction confirmed for tooth 36. Okay. Okay. Mobility grade 1, minimal, but enough for extraction. Okay. Just keep still for me. Keep your mouth open. Chronic irritation, but no periapical swelling, which will simplify things. Okay. Okay, so just hold still. Surface enamel is fractured. Okay. Irregular cusp line noted. Okay. Just open your mouth for me. Let me have a look. Root outline is visible. but I am unclear if this will be shallow enough for forceps. Okay. 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 So, I'm just going to administer some anesthetic to your lower left side to numb the area, and this, just to confirm, is the lower left 36 molar extraction. Okay. Sarah, thank you for your assistance. I don't need any more notes. You can go. Yes. Okay. Bye. Okay. So this is just a bit of anesthetic to numb the lower left injection site. The needle looks worse than it is. Okay. All you will feel is a short, sharp scratch. Okay? So, if you just open your mouth for me, and I'll just. You need to stay still. Stay still. Stay still for me, okay? And short, sharp scratch. Okay. Just open your mouth. Open. Okay, no. If you move, I won't be able to administer the anesthetic to perform the extraction, okay? So just hold still for a second, okay? And I will. Okay. You are only making this harder for yourself, so I'll give you one more chance at having the anesthetic administered. But if you can't keep steady, I will not be able to give it to you. Okay? It's just a needle. Open your mouth wide. Okay, that's fine. That's fine. Have it noted that the patient wishes to proceed without anesthetic. Oh. 1 second. Whatever you do now, do not move. You have been warned. Okay. So, got this cotton for you. I'm just going to pack this. Pack. Pack the cotton down into the extraction site to make space between your teeth and your cheek. Okay. Just going to pack this down. Okay then, so open your mouth. Let me just okay, and I'm just going to pack this down here. So open. Okay, that's it. Pack the cotton down. Pack. Same again. Open your mouth. Okay. And I'm going to pack that down. Cotton. Okay. Now we have an area where there is sufficient space for the extraction to take place. So okay, so hold very still for me now. No, let me try it again. I did say that it might not be possible with the forceps. Let me. Okay. No. This one is going to be more heavy duty. I shall need the Stanley. Okay. Now this is nothing to be afraid of. Slightly unconventional, perhaps, but it is sterile in exactly the same way as all of the other tools, and it is incredibly effective at getting out stubborn little molars. Okay, no need to panic. The calmer you are, the quicker this will be over. Okay, this is incredibly precise. So, let me just get that in to your mouth there, and then if we just tighten it, and then if I can just stay still. Okay, there's been a slight bit of bleeding because we've just loosened the tooth there, but stay still. Listen, your tooth is coming out now, whether you want it to or not. Okay, so even if you try and move, your tooth is clamped in my hand and it's not going anywhere. So the more you squirm, the worse you make it. So I suggest you stay still. Okay. And 3, 2, 1. Okay, it's being very stubborn. And I think it's a bit. See, that's a bit wobbly now. That means we're making progress. So, one final pull. 3, 2, 1. Oh, okay, there we go. Oh, there it is. Rotten tooth number 36. 36. 36. 36. 36. 36. 36. 36. Would you like to keep it as a souvenir? Suit yourself. 36. 36. 36. 36. Okay, see, we are all done, and it wasn't even that bad, was it? Once you cooperated, well, if you'd have accepted the injection, you wouldn't be in this mess. Let me remove the cotton from your mouth there. Okay, that is one wad. Okay, and just get this one. Okay, second wad. Right then, and let me just do a quick section of the extraction site. Yeah, okay. There's quite a bit of bleeding there. Let me just up the suction for a second to get this area. Okay, there we go. That's working nicely. Just suck that all up. Okay, that's it. And now I'm just going to remove the suction tube. Okay, there we go. And how is your mouth looking now? Other than a bit bloody? Okay. Right, there we go then. Now, when you feel able to sit up, you can take this for a little bit of a rinse and spit. Okay. I'll just leave it just here next to the sink. Okay. Let me just type a couple of notes into the system here. So, extraction successful, number 36, confirmed. Oh, and your invoice is £35 for the initial checkup, plus £380 for the extraction, as discussed, which is £415 in total to be paid at reception on your way out. I'll see you back here in 12 months' time. And if you come back next time and require another extraction, we are both going to be very upset. So let this be your warning to take your dental hygiene seriously from now on. Okay? Okay. Now, you need to get out of my chair. I have other patients to see.